Although I have one, I don't have two, so, you know. Actually, all right, bring it in. Ready?
That's what the new bachelorette says.
Oh. You guys rough days over the summer?
That's all fake.
No, it's not. Who said that? He just lost points. Yes, sir. Hang on. Do you need something?
Yeah, the first years if you sign up for that research thing form, we're not doing it. So, thank you.
Are you okay?
Yeah. It's just
Tired? It's Maymester. It's just we need to add, we need to submit that to like Merriam-Webster as a new word. Yeah. Y'all should submit that. Okay, so abdominal palpation lab. I'm gonna try to start it how I would with, you know, patient. So Jen, just after going over your subjective history and doing the objective exam thus far, I just want to check a few things in your stomach area, just in the abdomen region, because they can possibly refer pain, similar to that pain that you're getting in your back. But this really shouldn't hurt. Tell me if I do cause anything I perform causes that pain that you have in your back. Okay? And that's really about all I would say. Don't say, I'm going to check and see if you have a dissecting aorta here, because if that's the case, you really need to go to the doctor. Don't be specific. Don't scare them before you started what you're doing. Just want to check a few things because they can cause that pain that you're having in your back. I just want to make sure that really it is coming from something that's in your back that we can treat here in therapy. So be just brief, short, concise. Tell me what you're going to do. Let me know if you have pain with anything. I'm going to look first, then I'm going to listen, then I'm going to sort of knock on it a little bit just to see, get a sound back, and then I'm going to push on you just to see. Again, if any of it causes your pain, let me know. Okay? Is it okay if I tuck your shirt up? Sure. All right. And then we'll just use this towel right here. All right. Are you comfortable in this position? Yes. Okay. So arms just relaxed here, legs here. You don't have any pain lying down, do you? Okay. Nothing at all? Nothing. Okay. Good. All right. I'm going to look first. I do not see anything with that. An overall skin assessment looks really good. Okay. And you haven't had any changes over your abdomen that you've noticed? Now I'm going to listen. It's all. When'd you have lunch?
An hour ago?
Okay. I just heard it.
Did you see the orange?
So far, so good. This is the fake it till you make it part. Here, heartbeat too. All right. Now I'm actually going to listen to different vessels that come off of your stomach area. Sorry, my hands are cold. I heard your lunch again. Nice strong pulse. Good. We are going to go more iliac than we are femoral. Don't go down the pants. Don't worry about that. So I lied. Where do you palpate? Where do you palpate femoral pulse? Good. Really good pulses. I know, it was in my ears. Good. Nothing there. Good strong pulse. No problems now. Now I'm going to do that knocking thing just to see the noises that I hear from there. Is that okay? Let me know if you have any pain. I'm trying to remember cardiopulmonary if you guys are going to do 2 or 3 fingers. So I apologize. I can't remember how they're going to teach you cardiopulmonary. I should do it the same. You haven't had that. I don't remember. I'm not even pretend. 2 or 3 fingers down, and they might change that protocol. Sorry. So, knock with your knuckles, lay your hand down, and your ear has to be down there. If I'm up here, I can't hear it. And side. Not worried so much so about what I'm hearing on your left side. It's right side. And I can't knock as much. Oh, I'm going to hand up. No pain, right? Definitely very sound. What kind of drum is that? Just kidding. And you can do it anywhere. Anywhere. If you find a mask, you can do it anywhere on there. But go with 4 quadrants. Liver's going to be the big thing that you're checking. Completely normal with knocking, and you still don't have any pain, right? Didn't bother you at all? Now I'm going to palpate. Again, tell me if you have any problems with that. So I'm going to start up here. No problems at all? Okay. Over here. No pain in your back with that. How about over here? No pain in your back? And then no pain in your back here as well, correct? Okay. None of those bothered you. I'm going to go a little deeper this time. So angle changes to go deep, right? Superficial, pretty flat, deep. I'm going to angle in. Sorry, my nails might be a little long. Any pain if I push through there? You can even go right along diaphragm. Nothing there. Right here. Not that great. Have somebody like great, mash really. On the lunch you just ate, but no pain. And when I let go, no pain either. Correct. Any pain there? Nothing at all, right? And nothing here. Okay. Based off of this exam, I really don't feel like it's coming from anything up here, so we're going to focus more on your back, and we will hone in on what that problem is. Okay? Any questions? Good. Okay. Any questions with that?
Yes. Would you include, when you're doing this, would you include the costovertebral
that
thing
one?
as well? Yeah.
The deep palpation to get to kidney?
Yeah.
No, don't worry about that one. Because honestly, with us, I'm going to give you abdominal palpation. That way you have 4 things to do. Because if I gave you just confirm it's not the kidney, all you have to do is put your hand in the air and knock or beat, and you'd be done. That's not a fair draw. Somebody has to do like 25 things.
Okay.
So no, that won't be an option. And that will be the test that you use in PT, really. Is you will come behind a person and you'll go, does that hurt right there? Or you'll put your hand out, does that hurt right there? You won't. You don't need to worry about doing this. The one coming all the way through. Think of that as what they're going to do in P's. And MDs. Other ones. Oh, I did do that. Thank you. Oh, I'm just kidding. One more thing I want to check. I forgot. Sorry. I do want to probably order the order to show that one. But what I'm thinking is I'm going liver, I'm going appendix, and then in a sense almost just reproductive, region organs wise. I mean, maybe I guess technically I could say spleen up here on the left side as well with deep palpation. But those are the main things that I would be thinking that you, as us, we would be checking from a PT standpoint.
Yeah, you still want to, even if she had pain, somewhere that you could be referring to her back, and you would tell her that, okay, now I'm going to check her back to see if
I would, yes.
it might not be related to her.
As a PT, you're going to be doing the actual lower quarter screen before you would do abdominal palpation. The only time you're going to do abdominal palpation first is if something in this subjective scared you, and you jump straight to that. And if you find something that's not right, then yes, you're going to stop it and on. I'd be thinking abdominal
It's like the last.
But typically, I didn't reproduce their pain with my lower quarter screen, so I'm going to do this now. I mean, honestly, we hopefully aren't seeing these. But there's other constitutional signs and symptoms and things they've been to the doctor for. So this usually is not what you do first, it's more what you do last. Does that make sense? Okay. Bicycles just fake, you're pulling apart during one day. Aorta. So aorta, I heard it was a nice strong pulse. So it was right out, just up and over from the belly button. So I got an idea where it was from listening for pulse. If you didn't, you want to come in this region. If you come below, you're going to think, oh my God, this thing's ginormous, because now you're on LA. And there's 2 of them. So no, it does not go from here to here. It's just that there's 2 of them. Make sense? Okay. So just belly button slightly above is going to be the easiest spot for you guys. I could see it just a little bit. And when I was doing the lateral view or oblique view, do not freak out on really women for the most part, and more trim or fit men if you see it. I know that she said if you feel a pulse or see a pulse, that's supposed to be, not normal. But somebody thin, you're going to. I always, if I lie on my stomach, I feel it. So yeah, every now and then you do that. But I hope I don't have an aneurysm. No, it's good. So no, you're gonna see it in a lot of people. Don't worry about that. It's when you see a mass and a bulge, pulsating bulge. So I will start light and just see if I can actually feel it first. But it's underneath my finger right there, but I can't define the border. So to define the border, just push down a little bit deeper. Okay, and that's one edge of it right there. Now I technically need to let go with that hand, but then you're going to lose your edge. Come in with the other hand. If I need to, I can come on the other side. Right there's the other edge. So those are my two edges. What's it supposed to be less than?
3 millimeters.
You did say 3 millimeters, did you?
I did say 3 millimeters, but I don't think it's what
How small is a millimeter?
centimeters. 3 centimeters.
I think it was 5. Wait, it's
Five.
5, and you just, is it less than 6? You still just watch, and it's like, holy cow, that scares the crap out of me to think it could be that big. I think it's 3 to 5. So centimeters, yes. Because remember, millimeters are the little tick marks on the ruler. So we'd be in big trouble. Oh my God, get out of
3
here.
to 5.
Say again.
What is it? 3 to 5
Centimeters.
Centimeters.
Centimeters. Yes.
Not inches. It's like 3 centimeters is pretty much.
Yeah, it's about an inch. No, not inches, because that would be what, 3 inches and then 5 inches? That's too big. Yeah, so centimeters. And you were good to go. And everybody splits differently, so don't be alarmed. Go higher if you think, because maybe they are starting to split as well into their iliacs. So don't freak anybody out. Thank you. I'm sorry I forgot that. And it is. You find the pulse, and you move until you don't feel it, and then come back till you feel it again, and then you go on the other side, find the pulse, move until you don't feel it, and then come back in. And you're defining the edges. I'm not feeling the actual aorta. No, I don't feel a structure and go, oh, that's the aorta. It's the pulse. Okay? All right.